Hello, I'm Dr. Marisa Weiss, founder and chief medical officer of Breastcancer.org. Thank you all for joining us for today's webinar on becoming an empowered patient. At Breastcancer.org, our mission and our passion is to empower every person diagnosed with breast cancer to make the best decisions for their lives. I hope you'll find today's program helpful in doing just that. I'm honored to be joined by Dr. Lynn Jeffers and Dr. Anne Peled. Dr. Jeffers is the Chief Medical Officer at Dignity Health, St. John's Hospital, Camarillo, the Medical Director of the Integrated Breast Center at St. John's, and a plastic surgeon in private practice. She is also the past president of the American Society of Plastic Surgeons. Dr. Peled is co-director of the Breast Cancer Center of Excellence at Sutter Health, California Pacific Medical Center in San Francisco. Dr. Peled's background is in both surgical oncology and reconstructive surgery. Thank you so much for joining us. I'd like to give a special thanks to Merck for making today's program possible and for their partnership. Just to let everyone know, today's event is all about supporting you, whether you're newly diagnosed, in treatment, managing survivorship, or caring for a loved one. We asked what was on your mind when you registered, and you told us things like, how can I make sure that I'm getting the best care? I need my doctors to hear me and take my concerns seriously. I want more direct communication with my doctors. I don't want to be overlooked or forgotten. I want to be respected. All important questions that we'll discuss in just a little bit. I'm going to move on here just to let you know that, I call myself a dual citizen, a doctor and a patient. It was 11 and a half years ago when I got the call and was diagnosed with breast cancer. Although I never thought I'd get a free pass, I was still shocked. Despite being an oncologist, despite having cared for thousands of wonderful people in similar situations over my career, my world turned upside down, and it took a lot of time, attention, and careful thought to process everything I had to do. Being a dual citizen hits home and work in many ways, as I know it did for Dr. Peled and Dr. Jeffers. I want to thank you for being here as we share our experiences as dual citizens, both doctors and breast cancer patients. We'll be talking about this transformative chapter in our lives that changed how we see ourselves as people and as doctors, and what we learned along the way. We want to give you encouragement, ideas, and guidance that will help you in your own care. We'll be answering questions that you submitted when you registered, and we'll try to answer a few more live during today's program. Before I begin, I want to remind each and every one of you that your life is precious and you do deserve the best care possible. I understand the fear, stress, and doubt that accompanies a serious illness like cancer, and how hard it can be to sometimes trust treatment you're receiving and the doctors you've chosen to take care of yourself. For sure, trust is delicate. It has to be earned, but it also can break easily. Finding empowerment through knowledge, clarity, and a supportive community is why I started Breastcancer.org just over 20 years ago. When we talk about empowerment, what we mean is giving you the tools, resources, and suggestions to take an active part of your own care. But first and foremost, it's your doctor's job, their honor and privilege to help you. There should be a foundation of mutual respect, and it's not just your responsibility alone to build a strong partnership with your care team. It's something you can do together, and we'll talk more about ways to do that. Now I'm thrilled to welcome Dr. Peled and Dr. Jeffers to join me. Dr. Peled, I'd love to start by having you share a little bit about your background and what it means for you to be a dual citizen.
Thank you so much, Dr. Weiss, and to Breastcancer.org for having me on today. And I love that term, dual citizen, because, for me, it really does play a role every single day in my professional and personal life, kind of spanning both of those worlds. I actually come from a family of breast cancer providers. So my father is a breast medical oncologist. my sister and my mom are breast radiation oncologists. And so I'd actually been doing breast cancer research since I was 15 years old, and went on to then do a plastic surgery residence, and then went on to do a breast surgical oncology fellowship. So like you mentioned, I'm dual trained and do a combination primarily of breast cancer and breast reconstruction surgery. And like you said, it wasn't that I thought that I was going to escape this, if you will, but I was incredibly floored, surprised, shocked, the way all of us are, when at 37, with no family history of breast cancer, being a vegetarian triathlete, I was diagnosed with stage 1 breast cancer in 2017. And, I know we're going to talk on this panel about all the things that we learned, but for me, I felt incredibly lucky that I had access to great care, and it really transformed for me how we can think about getting that same great care for everyone, and really empower people like you mentioned. So I'm incredibly excited to be a part of this panel today and try to help others think about how to advocate for yourself the way that I felt I was able to advocate with my history and with my role.
Thank you, Dr. Peled. That's great. That's great. And Dr. Jeffers?
Hi, thank you for inviting me to this panel. Thank you to Breastcancer.org and Dr. Weiss. I'm so happy to come here and share my story and to learn from each other as well. But as Dr. Weiss said, I am also a plastic and reconstructive surgeon. The majority of my practice now is on breast surgery, and a significant portion of that is actually breast cancer reconstruction. As you mentioned, I helped to start the Integrated Breast Center at St. John's, partly because of my background, having graduated from the University of Michigan with one of the very first comprehensive breast centers in the country. When I came by a roundabout way of various different positions, I finally ended up in solo private practice, where I share an office with my husband, who's an orthopedic surgeon, and my dad, who is a general surgeon at the time. He's now retired. And at that time, really, we had a great group of people who were working together. We just didn't have a formalized mechanism and structure, which we built. And so that was all before my breast cancer diagnosis. And I think, as Dr. Peled and Weiss said, intellectually that 1 in 8 women get breast cancer, and intellectually that you're likely to be one of them. But when it actually happens to you, it's always a shock. And again, I know we'll be talking about what we learned, but there are so many different nuances of realization as you go through the process that you recognize intellectually when you were a physician, but you live. And so I haven't heard the term dual citizen, but I really like that term.
No, well, thank you. Thank you both. Well, I feel extreme gratitude. I think one of the things that one of my big aha moments in my own diagnosis as a dual citizen was the depth of the gratitude that you feel to your team for the care that they provided. But also another realization I had was you can have this deep sense of gratitude and at the same time feel frustrated, angry, or neglected, or upset, or confused, and all that you can have these mixed emotions all at the same time, which can be a struggle. And I did have the best care possible, but there were still gaps. So let's just dig into some of that. And let's start with 2 questions I know we all get asked pretty often. First, what one unexpected aspect of being a patient surprised you most? Let's start with Dr. Peled.
For me, I mentioned I have come from this family of breast oncologists and radiation oncologists. I'm dual trained as a breast cancer and reconstructive surgeon. And I was so shocked at how hard it was to make a surgical decision, to be completely honest. And I felt like I was as well prepared as anyone could be of complications and oncologic outcomes and how I might look and how I might feel. And it was really hard making that decision. So I think one of the things that for me has really changed is how I think about having that conversation with patients, how to really think through what matters to you, what is important, what do you fear, what does your life look like on a daily basis, and try to figure out how I can do the best job helping with surgical decision making in that setting. So that is actually something I feel incredibly grateful for, and was a huge surprise that I think has really helped in terms of how I talk to patients at this point.
Wow, and what a gift to other people. Dr. Jeffers, how about you? What was the one unexpected aspect of being a patient that surprised you most?
Like Dr. Peled, I work in an integrated breast center, of course, and my brother is actually surgical oncologist, thank goodness, because he really helped me throughout this entire thing. And my father being a general surgeon who also did breast cancer surgery. But the one thing is, to be quite honest, for myself, the surgical aspect, I've thought through multiple times going through this, thinking if I ever got this, I was going to get bilateral mastectomies, and I knew what I wanted to get. So that part I knew. But surprisingly, even though I work on a team environment and I've listened to all these tumor boards every week, when it comes to you, of course, it's never black and white. And I was just surprised at how uncertain sometimes you are that you are making the right decisions, and sometimes powerless, not because other people aren't empowering you and not because you don't have the best care, but because you don't really have control, and there's really unknowns that nobody can answer. And so I think, honestly, that was the most surprising to me, because I thought to myself, gosh, if I'm in this boat, somebody who is in this field, who deals with this every single day, what it must be for my patients who have no medical background or no family members to help and no support system that we have. So I just remember thinking that. And I also think the part of that was also remembering how the smallest things can make such a difference. And we will probably talk about this, but just the smallest things about knowing that you trust your team, and that knowing that they take your call, and that they don't make you feel like you're asking the 10th question for the 10th time, and how the smallest things can make such a difference in your life.
Right. No, that's so true. And get to even, and when you talk about the smallest things, it could be as simple as one word. There's one surgeon who said to me, I saw your mammogram and I saw that ugly thing on your mammogram. And I'm like, ugly thing. Like, I know that doctors will talk about, radiologists will say there's this ugly thing on the mammogram, but to say that to a patient, like, there was this ugly thing on your mammogram, it was sort of that haunted me. It was like, oh my God, I've got this boogeyman in my body that shouldn't have been there. And it betrayed me that this whole thing happened is just was devastating. But just words like that, things like that can make a big difference.
Yeah, and even on the flip side, somebody where I knew I was asking a question, but I couldn't make a decision on something, and the person just saying, look, this is about you. You make that decision for yourself, and sort of empowering you with just a few words.
Right. Absolutely. Absolutely. And just to make you feel like, go ahead.
Oh, sorry. I was just going to say, I also think it's the words you use, and it's also kind of when you use them. So I know for me, I try really hard when people come in in most cases, fortunately, this is true, to set the stage from the moment we start talking. I hope someone's already told you that this is small and highly treatable. And we're going to talk today about what kind of treatment you need to get to that highly treatable place, but you're going to do just fine. And I like to start that before we've gotten anything else. And you can physically see people settle in and relax when you're setting that stage at the beginning, right? And it's so timing, I think, matters too, and words so much matter.
Absolutely. I mean, I start after my diagnosis, I started something called the full life view, which is basically one big fat arrow from left to right. And it starts with where we are right now. And I say, the where we are right now represents the present. But I look towards the future. If someone's, let's say, 37, you were saying upon diagnosis, I'll say, let's get you, from 37 to 87. And after that, 107 if we can. But first we got to get you to the next 50, 37 to 50, 87, if that applies to your situation. But I also, even before I get to the full life view and reassure people that they do have a future full future in front of them, I always start by asking, how can I be most helpful to you today? Which does also help people relax a little bit and feel like, oh my God, here's a doctor who's going to listen to me, or wants to know what's on my mind, and then you can immediately address what's going on for them, like what's top of mind, what's keeping them up at night.
And those things could be some of the smallest things. Again, we were talking about smallest things as far as words, but also in your life. I mean, you don't realize how important it is to have taste, like during chemo, or how important it'd be nice to have a bidet, for example, or just even to have control over when you take your pills. Just the minor, small things that we don't think about from a medical field, but just impact your entire life.
And absolutely, I mean, during COVID, even getting the very basics, like having your kids taken care of and have food on the table, and having rides, and getting your medicines, and getting access to your doctors, like all of that was on shaky ground, and still is for most places in the US and around the world. Let's get to the second question. And I know I get asked a lot, and I'm sure you have also, but I'd love to hear what your response is whether going through breast cancer has changed how you care for your patients. How do you guys answer that? Let's start with Lynn, Dr. Jeffers first this time.
You know, I don't think that it's changed how I care about them in the sense that I think that I was pretty an empathetic and caring doctor before, and it doesn't change the treatment that I offer. But I think what it did bring home to me was that, and I don't think I really recognize this, was that no matter what stage you are, it doesn't matter what stage you were diagnosed at and what your prognosis is and how people are going to say that you're okay. Doesn't matter how long ago your cancer treatment was. The people that I talk to anyway, it's always in the back of your mind, sort of waiting for that shoe to drop every time you need to have a scan, that anxiety and things like that. So I think that I became more cognizant of that and that extra emotional toll that cancer has on all of facets of your life beyond just your treatment, recovery, and side effects. It's not like you're getting your gallbladder out and now you're okay. And the effect that it also has on the patient's family and their loved ones around them. So I think that's really what hit home, besides some of the things we just talked about.
Right. I mean, just getting dressed in the morning. I mean, at the end of the day, I mean, you know, there hasn't been a day since I was diagnosed that I haven't seen something or thought about it, and it's been, you know, in your face or sort of in the corner of the room kind of thing.
Right. And my treatment was more recent, so, you know, just little triggers. So
yeah,
you just forget.
Right. And we're almost on Breast Cancer Awareness Month, where we're going to see, even in the middle of COVID, we're going to see, you know, special articles and shared stories and things like that, which are reminders, you know, connect us in a powerful way for many people. And in some ways it can be uncomfortable. Dr. Peled, how about you in terms of how has your own diagnosis maybe affected how you take care of patients?
I would definitely echo what Dr. Jeffers said. I mean, I had to get an unexpected MRI of my spine recently because I was working out a lot and had terrible back pain. And I was talking with my sister, who's a radiation oncologist, and we were just talking about the fact that unfortunately, you know, back pain doesn't just get to be back pain anymore, right? And that's a really major shift. And it turned out everything was great. I felt really fortunate, but it's a really major shift to think about. A few years ago, I would have just thought too much time on my Peloton, and that's what it is. So I think that's a huge one that connects us with patients in this club none of us wanted to be in, but we can all understand now. But I would say for me, you know, the big thing is realizing just how disruptive cancer is for your life. And I felt like before, as a breast cancer and reconstructive surgeon, I understood, you know, form and function and oncologic outcomes and getting people through it and trying to be supportive. But now I really think about, you know, how can we get people past this and back to all the things that mattered to them before they found out they had cancer and are going to matter afterwards. So thinking about, you know, asking people about their family. Do they have kids? How are you going to talk to your kids? What does your activity look like? What does your workout look like? I joke in my practice, I can tell everyone exactly when they can go through back to Orange Theory or Barry's Boot Camp or Peloton workouts, because I just have such a good sense at this point now, because that really matters to people. Jobs, you know, what does your work look like? When can you get back? When can you go back to your family? So for me, I think just really getting a sense of the people that our patients are before they found out they had breast cancer and really trying to work with them to get them back to that. Again, it's really strengthened my relationships with patients. I'm very active in social media and other ways in a breast cancer community. And personally, I love that connection where we can, you know, if people ask me, I'm happy to share my story about what worked for me, but otherwise we focus on them. We ask them what matters, what their fears are. And I love that deepened connection.
Right. I mean, when you go through breast cancer, you realize like how sacred that doctor-patient relationship is, and what an honor, truly an honor it is to be chosen to, you know, be on someone's team to help protect and cherish their lives. That's like, you know, that's nothing gets, you know, more important than that, or a greater responsibility than that. And so that leads to our next question, which we have from our audience, is how to choose a doctor in the first place. And then what do you do if you feel like your doctor isn't the best fit for you? This came from our audience. You know, one thing that is critical, I think, is finding a doctor who loves what they do, who is really, you know, engaged in being a doctor and who enjoys the fascination of taking care of each individual patient, who's different from the last one, you know, and who's going to be there for you, who takes you seriously, you know, who is accessible and all that. Dr. Peled, what would be your, do you have a practical approach to how to pick the best doctor in the first place? And what do you do when it's not a fit anymore?
For sure. So, for me, I think that finding someone who is on top of the latest care and innovation is incredibly important. And so, one of the things that we see a lot, unfortunately, is you don't know what you don't know. So, I hear from women all over the country, and they didn't know that they could have the option of nipple sparing mastectomy, or they didn't know they could have a breast reduction at the time of their lumpectomy. And it's really hard because a lot of the choices we make, they're permanent and you can't really go back and fix them. So, one of the questions that I suggest people ask their doctor is, for my personal situation, my cancer, my body type, my goals, are there any advances in technology or techniques or approaches or medications that you would suggest for me? Are there clinical trials that I could participate that would allow me to get access to the latest and best care? And I think if you ask these kind of questions, you'll get a pretty good sense of if your doctor is someone who's really engaged in advances in breast cancer care. And unfortunately, we don't all get access to people who are at that cutting edge and forefront, but at least the hope is that you'll hear from someone, well, you would be a good candidate for a clinical trial, and we don't have that clinical trial, but let me try to get you to the right place. And so for me, I think that's the best step to making sure you're getting the best care. I think the fit question, though, is so important. There's no question that you have to have someone who hears you and listens to your questions and lets you come back for more. Dr. Jeffers mentions, the 10th question, you've got to have someone who that 10th question, they hold that space for you in the same way they did for your first question. And that's hard to find, but I think is worth fighting for as a patient, to find someone that lets you do that.
And I would so agree with that, but there are also practical constraints. Like, we each know patients who haven't been listened to by other people, or who have been, but have a lot of questions and are really struggling to process everything and make a decision. And it's an hour has gone by, and they have, so I think it's okay to say, these are all great questions. We can't get to all of them today. Let's, right at least, and if possible, right up front, to say, let's hit on your most important questions first. And then if there are extra questions, let's make another appointment. Like, we can do it by phone, or there are other doctors who would better give you who are more expert in your questions. So, for example, I'm a breast radiation oncologist in my clinical practice. If someone asked me about chemotherapy, I would say that's great question. You can bounce it off of me, but really you deserve to get the best care possible, and that means the best out of each specialty, and that means getting your question answered by a medical oncologist. And also, I know we shared earlier that a lot of people will ask what I did, what you did for your care. And the reality is that each one of us had to struggle to figure out the best solution for our own individual situation. And even if someone chose, let's say, bilateral mastectomies, breast preservation therapy is still an option for many, if not the majority of women. Or it may not be in your situation uniquely, but you need to have that conversation. Like, what are my options for me in my unique situation based on the extent and nature of the problem that I am up against? Let me get to go ahead, please.
I was gonna say, your points point to exactly what I was thinking. When you originally asked this question, of course, you want to look at the credentials of who you're working with, of course, that they, obviously trained in the fields that you're seeing them for. And obviously for breast reconstruction, the plastic surgeons, you want to look for a board certified plastic surgeon by the American Board of Plastic Surgery, who's a member of the American Society of Plastic Surgeons. But if you're looking, I think it's, you're talking about, you should be looking for somebody who's working within a team. I mean, cancer has to be a team approach for the very reasons you just said, Dr. Weiss. I mean, there is no way, and it certainly showed me once I was diagnosed, that I do not know enough about oncology or radiation oncology or all the different aspects that have to do with your whole person care. And so that's partly why we started the Integrated Breast Center, was that I was getting patients, like to what Dr. Peled was saying, who came in and unfortunately never saw a plastic surgeon before their mastectomy. They had radiation, and now their choices are different than they would have had they possibly seen us. And maybe they would have chosen the same thing, but they weren't given that choice. And so that's partly why we got together and said, look, for the people who are not seeing us, we want people to know that this should be a team approach. So I would look for somebody who does have a team around them. Our center is accredited by the National Accreditation Program of Breast Centers, which I think there's only 53 in California, but that really shows you that they are following national standards. you also want to just feel comfortable that this team and your physicians are your advocates. I always say it doesn't really matter who's treating you if everything goes well. It doesn't really matter who operated on you if everything goes well, right? But you want to be sure, you want to feel that your team and your physicians are going to stick by you when something doesn't go quite as planned, that they will be there for you. They will answer your questions and help you get through the best that you can. And the last thing I'd say, you asked the question of what happens when, maybe you realize it's not a good fit. That I encourage people to get their second opinions. You really want to feel comfortable. I'd rather somebody go out there, get a bunch of second opinions, and then come back and say, you know what, I actually, I did all this and I still want to come to you. I'd rather people ask their questions before and not second guess themselves after. And I think, physician who is your advocate will encourage that, unless the only caveat I'd say is don't delay your cancer treatments, right? So that you get so many second opinions, you're really delaying the treatment that you absolutely need.
Right. And sometimes it's hard to compare and judge one doctor against another when you saw the first doctor, they didn't have all the information that you now have, like the oncotype was not back, or you didn't have the MRI report, or maybe that day you got lost getting to their office, so you were only there for 40 minutes instead of an hour. I'm just saying, so that there are various reasons why one doctor on one day may feel more comfortable or better than another. And we as women, and for the men also who are on the call, and when it comes to something serious like a cancer diagnosis, you need time and to think things through and process all the information. Sometimes, of course, it helps to bring someone with you, a second set of ears, someone who can really, share impressions, just to make sure that you can you can process it together rather than just feel like, did I really make that decision on my own? And does that really make sense?
Can I jump in? I think, I was just going to say on the second opinion part of it, because I think this is one of the things that's really hard. And I think it's hard for all people, but it's especially hard for women, I think, to feel like we don't want to be insulting our doctors. We don't want to make them feel like we don't trust them or we don't think they're great. And I think that balance is really delicate. And, the thing that I tell people all the time is the only person waking up in your body every day is you. And so the reality is it doesn't matter whether I am the right person for you or not in terms of your actual care. What really just matters is that you get the right person for your care. And so I would say the idea of asking for a second opinion, of asking if there are other treatment options, of feeling like you have an open conversation with your doctor is incredibly important. And honestly, if you run up against someone who you ask for a second opinion and they're not supportive of that, that probably isn't the right person for you, because that isn't a person that's truly invested in you and the right treatment care for and plan for yourself. So I would say, again, I know sometimes people feel like asking for a second opinion is insulting. It's not. It never feels insulting to me ever. And so I hope that everyone on the call can hear that. I see Dr. Jeffers nodding, like it's not insulting to us. We just want you to get the right care for yourself. So please, please, please ask for second, third opinions, do it. It ultimately is going to make you feel best about going into your treatment.
And I completely agree. And it's also good for the physicians that are treating you, because you're going to come in more prepared. I'm not saying everyone needs a second opinion, but if you have doubts, that's when you really want to go out there and make sure that you feel as comfortable as you can be with the decision that you're making, because you just nobody has a crystal ball and you just don't know how things are going to turn out. And just as you heard from Dr. Peled and us, and myself and Dr. Weiss, we each had decision points and nobody could tell us how it was going to be if we were making the exact right choice. You just want to come out at the other end saying, I made the best choices I could for myself with the information that I had.
Right. And I would also say that, that these conversations are all happening in the context of a very sacred doctor-patient relationship. And it is a relationship. So if you do feel, really happy with a visit you had, or grateful for the care that you received, or really happy, pleased with an answer that you got, let your doctor know. Say, oh, wow, thank you. That was really helpful to me. Or I really appreciate the chance to be with you today. Or I feel really, relieved and happy that you're my doctor. That goes a long way in forming this relationship that will grow over time so that you can, as you move through your life, you can make sure that your team is handling the needs that you have at that particular point. And in terms of how you let doctors go, I mean, when you're making your way through this whole journey, you don't have to worry about breaking up with somebody. You can find another doctor and establish a relationship with that doctor. And if you feel at some later point that you need to let the doctor know that you shed off, that you're no longer going to them, fine. But your energy is precious and limited, and you really need to save it for the journey that ahead and invest it in those relationships that are in the keepers and the ones that you do want on your team. And then it's going to take energy to help facilitate the communication between your team. You have to give permission to have your information shared from one office to another. If you're in one center like Dr. Jeffers Integrated Center, then it happens automatically. But if you are seeing different doctors from different places, which is often what happens in where I am, you have to get permissions. And there's a lot of work and it requires energy. So really save your precious energy for building your team and getting your care in order, and then finishing up the care plan and putting it into action and getting started on your care so that you can get things going and move on and then get this whole thing behind you at the appropriate time. Let's move on to the another question that came in. Just practical tips on how to prepare for appointments. I know that preparing for these appointments can help alleviate anxiety and help us feel better about taking an active role in our own care. Dr. Jeffers and Peled, what do you do personally ahead of a meeting with your doctor that others can learn from?
Well, one of the things I do, which I laugh because I so appreciate when patients do it for me, but it might be a little OCD, I don't know. But I actually have a list of all my medical history, my procedures, medications, allergies, family history. It used to be easy because it was all none, but then suddenly this happened. And you'd be surprised there's certain dates you think I will never forget that because it was so impactful, and yet soon you forget which date was that, what month was that, what year was that. And so now I have a document that I just print out every time I'm going, especially if I'm going to a new physician. And they're so relieved when I hand that over because they can use that later. And we can actually focus our time together on the other stuff, not the things that are all written on there for them. I also, depending if it's a follow-up visit or something like that, I try to keep notes of important things, like when was the last drainage or the symptoms I had when it was, or the last pills, especially immediately after surgery. And then they always tell you, and it's so true, keep a list of questions. I didn't think so in the beginning, but boy, how many times you walk out and 5 minutes later you're in the car going, oh man, I wanted to ask him this, or I wanted to ask her to do this, and so I do that. And the last thing is to, if possible, bring somebody to help remind you and to help listen for you. I think those are the things. And then up front, setting up that expectation. Like, I do have a few questions that I want to ask you, whether now or at the end. And so that your physician knows that there's a few more questions that they need to make time for.
Absolutely. I mean, we're pretty good at developing our grocery list. So that when we hit the grocery store, we get what we need. We don't like the feeling of being in the car and thinking, like, damn it, I forgot the cornstarch. So
I went in for cornstarch and came out with 50 things but cornstarch.
Right.
Yes,
So you want to
always.
make sure that you handle, if you're as good as you get with your grocery list, you're going to handle this, you're going to make your list for the questions and concerns and things you want to report to your doctor when walking in.
I'm sorry, I'm going to make a quick tip on that. I started to use something called Google Keep, but there's many different apps like that. It allows you to just do it on your phone anytime you think of it, or if you're on your computer, so you don't have to do the entire list all at once.
Oh, that's great. Thank you. How about you, Dr. Peled? How do you get ready for your doctor's visit?
So the listing, I think, is so key. And I laugh because my patients will sometimes be like, I'm so sorry, I have these questions as they're pulling out their phone. I want to be like, no, you should be like, you're welcome. I brought in questions and I have them on a list, because then you don't have you get to the parking garage and you remember your questions, and then it's a follow-up email and it's not the same kind of communication as in person. So for me, I do the same thing. I make an ongoing list when I think about it. I think the other thing, and this again is something that comes up about symptoms and interacting in this relationship with your patients and your physicians. And a lot of times people think that talking about whether it's side effects of medications, whether it's pain or other issues you're having post-surgery, whether it's your issues with your reconstruction and how things feel and look, people think that, as physicians, we might take that as complaining, or that it might be something that we don't want to address. The reality is, I think all of us probably try, in the limited time constraints we have, to ask those questions. How are you feeling? What kind of side effects might you be having? But we might not get to all of them. And so there are side effects or things I might not think to ask about, or I didn't have time. And I would love for people to bring those up, and so that we can have that conversation. It's not that I don't want to talk about it, I just might not have gotten to it or had time or thought about it. So for me, what I do personally is I try to keep track, especially of when they're happening. If I'm having weird things, like I talk to people a lot about, I used to get a lot of leg cramps on my tamoxifen at night. And no one had talked to me about leg cramps and tamoxifen at night. And I ended up talking to my dad, who's a medical oncologist, and he knew about it. And now I take magnesium at night and I don't have leg cramps anymore. And it's such a small, easy thing. And I tell people about this all the time because it's something, again, if I hadn't thought about bringing it up in my visit, someone might not have asked about it. And so for me, I keep track of all my weird symptoms. I try to have some, cohesiveness when I bring it in, so I'm not just unloading all of them on my medical oncologist. But I do think that that's really helpful, is if you can see when are they happening, what is happening, and try to find a pattern with your doctor.
Right. I mean, talk about doctor privilege. You have your father you can call. That's awesome. That's awesome.
Well, it's kind of a mixed bag though. So it is awesome, but it's also, we're loud, but all my family members were very good about not giving me free advice during my diagnosis, which I appreciated. But sometimes I watch my dad and I know he just wants to give me advice that I'm not asking for. And he's really respectful of it.
Yeah. Well, so I'm glad in this conversation, just to let people know, it's when you're rating a list, it's not just questions, it's also concerns and signs and symptoms that you notice that you want to share.
Yes.
And also this list, if it's in Google Keeps or whatever, the back of your, on a pad of paper or on your notes and your phone, whatever, make sure that they're legible, particularly if they're scribbled, because you don't want to waste time trying to figure out what were you trying to say. And also you want to put your most important, most recent questions on the top, because sometimes, the conversation does go long and you can't get to the whole list, and you want to make sure you at least get to the questions and concerns that are most relevant to you, that are active in your life right now. That's really.
And I want to add also that sometimes I learn a lot from my patients. Going through chemo, and you realize that each cycle was different, and yet you don't know what you did differently, right? You get the same dose of the same things, but they would tell me, did you know? It's sort of like what you said. Did you know I heard that you take magnesium at night and then you don't get cramps? Wow, I just learned something I hadn't known. Maybe I knew it, but there's some things that I don't know, and I learned so much from our patients bringing up things that they're dealing with and how they've dealt with it. And I can then help to pass that on to other patients.
That's great. I mean, one of the most amazing things about Breastcancer.org, it's an organization I started 21 years ago, but it's been, there's so many critical people who've been responsible for its success meaning helping now 21 million people get the best care possible, including Adam, Ellen, Lisa, who are on the call now, who are key on our team. Is that we have our finger on the pulse and we see what's happening in our community, people helping each other share how to prepare for your next visit, what to expect with your next cycle. It's different from the last one. I remember recently I had a meeting with an individual that we scheduled it after her after her first dose of chemotherapy. And it was on day 3 after chemo. I'm like, I don't think that's going to work. And she was like, yeah, it's going to work. It's no problem. And that day I spoke to her over day of her chemo, the day after, and she was like flying high still on steroids. And yet she didn't realize she was going to crash in a big way on day 3. So of course dinner was postponed, but we could have told her that. But she would have wanted to know that. But that's what at breastcancer.org that we can do, is to try to help people anticipate what's next, how they can be what they can do to get the best care possible as they move through their journey. And try to get through their treatment to the other side. Now, I know that the time we have with doctors and nurses is really time limited, and it goes by so quickly. And sometimes we're really feeling nervous or don't feel well, and we might forget what was discussed. And sometimes we're not even sure what questions to ask. We don't know how much time we're going to have to get with that doctor at that particular visit. So it's hard to plan how much to cover. What can people do to feel like they've gotten the most out of that time?
We try in our office to let people know how long their visits are going to be, especially that first one. So I do think you're right. You have no idea, if you don't know if you have 30 minutes or an hour, it's really hard to prioritize. So it's okay to ask, how much time do you think I'm going to have? So that helps. I think bringing someone with you, it was so hard during COVID when we couldn't have people bring their significant others, their partners, their family members back. And I'm really glad, at least right now, we're in a better place from that perspective of having family members there to listen. I think recording the visit is great. There's so much that you're not going to keep in your brain, especially if you're in the midst of other treatment. And so being able to go back and listen to that recording, I think is always a really good choice. And then the final thing I think is after you've gone through your visit is to go back, see, are there major questions that you feel still aren't answered that are going to impact your treatment decisions? And then if you have those, it's okay to reach out and ask, can you have a follow-up call? Can you have a follow-up visit? Is this something you could send via email? Is there someone else? We have a physician assistant in our practice who's fantastic. And even if I may not have time for some of those follow-up questions about recovery, they can get on her schedule and she can answer them really well. So it's okay to ask if you can have some kind of follow-up conversation if you really feel like there are things that didn't get answered or didn't get fully covered, or you have questions still that are going to impact your treatment.
Absolutely. And it may be that people write in on the electronic medical record system through the patient portal, or they make a call to the front office. And it's always good to let the doctor know when they can call you back up and until what time, because I know my own schedule, I know we start at 6:15 in the morning, and we're in the bottom of the hospital, so I often don't even know what time it is. I can't even see the sunlight. And by the time I crawl out of there, it might be my first chance to get to see what kind of questions came in during the day. So don't think that your doctor is ignoring you. It might be they're really busy. And as Dr. Peled said, there are other people on the team that can really at least start to answer the question, or maybe be able to tackle the whole question for you. How about you, Dr. Jeffers?
And I think that's helpful also, because if you are part of a team like an integrated breast center, often there is a patient navigator who can answer a lot of the most common questions specific to plastic surgery and so forth. Obviously we get, but I give my patients my cell number, and they know, and so far, knock on wood, nobody has abused that. And trying to specify at the end of the conversation, what's the best way for me to ask you further questions? Should I make an appointment? Would you like emails, patient portal, get an idea of what different offices are the most effective to communicate with them. The one thing I will say, we talked about lists and we talked about preparing and asking your questions, doing your homework. But the one thing I try to recommend to my patients is think about what you want to get out of this visit. Like, why are we meeting today? And what do you want to come out of this visit with? Because you do have your list of questions, but overall, like, what's the most important 5 things that you want to know from this visit? And that might not be just the answers to the questions. It might be like, so what's the plan? So where do I go from here? Or maybe really what's bothering you, even though you have all these questions, is, will I make it to my daughter's graduation or something like that? So it's not always the specific questions, but something else that's really been bugging you that you want to address, and to be clear to yourself that you don't walk out of that room without it. And you kind of set that stage, like I said, with your physician, because often what happens is we don't know that you want that. And then we get done with our part. And then you say, oh, by the way, and you're thinking, oh, wow, gosh, I wish I had known we would have started with this.
Right.
So.
That's why I suggest that, for all doctors seeing anybody with a medical problem, to start the visit by saying, how can I be most helpful to you today?
Exactly.
And it was done. I created that just because of what you're saying, Dr. Jeffers, is that, I can finish my little spiel on it, and I'm feeling good about myself. I handled that. It all went well. But then she's like, but I have some questions. And it turns out the whole time she was worried about the bone scan that some other doctor ordered, that she's been worried about, that she hasn't gotten the results of. And I had no idea she got the bone scan, that kind of thing.
I always use this example, which I think is so important. And it's the same question. It's how can I help today? Or what are you most concerned about? I had a patient when I was a fellow who had a lumpectomy, or we were talking about options, was thinking about having a lumpectomy. And we talked about radiation. And we always say, radiation is every day. It's 15 minutes a day. We go through the whole thing, right? And the patient was really thinking about having a mastectomy. And we were talking about it. She really didn't need one from a medical standpoint. She thought that radiation was every day of the week, including Sunday, and didn't want to mess with her ability to go to church on Sunday. And that was really important to her. And she was making a surgical choice because she thought she was going to miss out on something that really mattered to her in her life. And so, now radiation is every day, Monday to Friday. I say that every time now, but it was such a huge moment for me to see that these are the things that if she had said at the beginning of the, it took a long time for us to get there and realize that was the barrier. And we would have totally changed the whole conversation earlier had I known. Right. So I do think your open-ended question is such a good one, because it gives people that space to tell you these things and let you either answer them or explain the misinformation or whatever it is that you need.
And also it teaches you, to modify what you do, not knowing what's most on someone, it's most important to somebody. I mean, I just learned from your patient by our sharing today. Now, there are a lot of doctors that are more formal or more authoritative, and there are some patients who like that like to be taken care of and be told what to do. And Breastcancer.org takes care of people all around the world. In fact, over half of the people who come to us come from other parts of the world where it's a more formal, hierarchical relationship. So, and also there's just an inherent imbalance to the doctor-patient relationship, where the doctor has the expertise and it's their language, all these big words, it's on their turf, it's their timetable, and that's all very intimidating. And sometimes people feel powerless in that setting, and may even feel like ignored here and there, or their opinions don't matter if they're in a situation where the doctor's sort of dominating or leading and all that. What can you do if you feel like you are powerless, dismissed, or disrespected, or ignored, or you don't feel like you've been taken seriously?
I think we can learn from other parts of things that we are dealing with when we talk about teaching our daughters empowerment and assertiveness. Put a name to it. I was going to say earlier, when we were talking about interacting with patients, if you have the whole conversation, you can just see that somebody's still hesitating. I'll often say, you look like you're still uncertain, or there's something we haven't covered, it looks like, and you put a name to it. That gives people the ability to do that. But if your physician doesn't do that for you, and yet you're feeling powerless, you can also put a name to it by saying, I'm not feeling empowered, but I would like to have a greater role in my care or in my decision making, and really put a name to it. And how they respond is going to tell you whether or not this is a good fit, going back to our previous conversation. And if they're not open to that, then maybe you need to find somebody who's a better fit for the type of shared decision making that you want.
Right. In fact, one question that came up that was, someone said, they put a name to it. They said, how do I deal with my oncologist who's such a pessimist? More doom and gloom. Well, that's a really important observation. Like, if you feel like your styles don't match up and that you want someone who's more upbeat, then, take the time to find someone else that you might, gel with better. Because that can make a big difference, having someone feeling more upbeat, hopeful about your situation.
Right. Yeah, I mean, I had a member of my care team who I appreciated was really trying to set me up for all of the potential things that could happen. But I really felt like, she knew what I did. She knew what my job, we shared patients. And I honestly felt like I didn't need that. I saw a lot of people in my practice that didn't have all the things that she mentioned, and it felt like a sort of risk and benefits was important. But after that, I didn't need all of the, what it was like being young and getting diagnosed with breast cancer. And it really honestly changed the ability for me, sorry about my dog, it really changed the ability for me to have that good interaction with her going forward. And I had my care, but I stopped following up with her and went back to other providers, because I really had this just huge sense of doom going to the parking lot where her building was after what was set up. So those things we do, it really matters that you find someone that fits with you in that way.
Right. Well, we have a few minutes left, and I want to get to one point that relates to this, is like that, most of us want our doctors to like us, right? And we feel like if they like us, they're going to take a call from us. They're going to be more likely to spend time with us and think about our situation more and all that. It's part of our DNA for many people, those people pleasers. But the problem with that is we may minimize symptoms because we don't want to seem like we're complaining or being a burden. How can we overcome this instinct to please? And how can it actually backfire and mess up our relationship with our care team? Dr. Jeffers, want to go first?
Yeah, I'd start with the instinct to please is not necessarily in of itself a bad thing, but it is a bad thing if it goes against what you want or hurts you or your care. And so, we talk all the time about medicine being an art as well as a science, and people are just not widgets, as you can tell from the conversation today. And we as physicians, it's our job to try to adjust our treatment and plan depending on what you want, what your body's reactions are, what your emotional reactions are, and to make sure that we help you decide what's best for you, for your specific situation. So it's important to let your doctor know if something isn't quite right, or there's been a change, or you're not happy about something, because at the end of the day, going back to what Dr. Peled said, this is your care. No one's going to care more and know more about you than you. And we're here to help you, but you are your own expert. And this is the one time in your life, well, many times in your life, but this is the one time for sure in your life, the focus should be about you and about healing. And you have that empowerment to do so. And if things aren't going well and you don't tell us, it can be dangerous. There are some symptoms that actually can mean other things. And frankly, feeling that sense of disempowerment can be traumatizing. When you feel powerless, it's not just a matter of, oh, not feeling great or pleasing someone. It's also important for your overall health and your overall medical care.
Absolutely. Absolutely. Thank you for that. And Dr. Peled?
We'll see how my dog does. So I was going to say, I agree completely with Dr. Jeffers about the idea of that it is only, you need to share because it matters to your medical care. So for me, I would tell people, especially from a reconstructive standpoint, there are people I look at and I think, oh, you're perfect and all is good to go, but they don't feel that way. And if I don't make space for them to tell me that, maybe we need to do a revision and maybe we're going to get them there. But really, again, what ultimately matters is what they're seeing when they're in the mirror. And I don't take it personally if people bring up issues with their reconstruction. Again, similarly to symptoms, it's no one's fault. And we just want to be there to support you. So again, never worry about making those things known and about advocating for yourself, because your team will support you.
Absolutely. One thing you learn through all this is, your life is really a gift, and it's you that it's your life that's at stake. You're the one living with yourself 24/7. You're the expert, and we all need to learn how to advocate for ourselves. We are the experts on ourselves, what we're feeling and what we're thinking. We have the most invested in our well-being, I think you've all shared ways that we can do that. Is there one way someone can best advocate for themselves or a loved one? This is our last question at the end of our program. What would be the—
I guess, sorry, I was going to say, I think for me, the best way to advocate is if after you've had your diagnosis, you're thinking about your treatment options, really think through, on a daily basis, what things matter the most to you. What are you most afraid about getting impacted? What are you most afraid of going forward? And I think if you're able, it's a really hard thing to do. Again, I struggled a lot with this, but if you're able to put down into words what those things are and take that to your treatment team, that is going to be the very best way for you to get a treatment plan that fits with your own life and your own goals. And so again, I think that can make a huge difference for getting the right team and also getting the right treatment.
That's awesome. Thank you. Dr. Jeffers?
It's so funny. Dr. Peled and I probably it sounds like we sat down and copied answers from each other, because I had written in my head when you asked that, self-reflection and what your real priorities are. And not just like, I want to get through this and I want to be, but like, what to you are like markers of success, like being able to ... being able to get to ... being able to, like you were saying, being able to hike because that's really important to me, or being able to water ski again because that's really important to me. Whatever those real priorities are, if you take that time to reflect, you really can give yourself, first of all, you figure out what's really important in your life, but you also give yourself some goals to go for. And if your doctor knows that, they can really help you achieve those things, because we can't tell you what your best goals are and what's going to be most meaningful in your life.
Absolutely. And of course, that's going to change over time. So when you get, worried about breast cancer, if you can shift your way you think about it to what's most on my mind, what are my biggest concerns, what can I share with my doctor, what can I get more answers and support about when I next go in? And if it's not for a month or two or a few months or 6 months away, make a telemedicine call. That's a great application for telemedicine visit, is to get questions answered. Dr. Go ahead.
If I could just add one thing, which I took a long time even for myself, is to give yourself permission. Give yourself permission to focus on yourself. Give yourself permission to take some time off. Give yourself permission to not be 100% yourself, and realize that you have the right to do that. And you have the right to ask those questions. And there are people around you. If you don't have the support system, there are people around you willing to be your support system.
Absolutely. Take the time to heal also, which takes a long time. Well, Dr. Jeffers and Dr. Peled, it's such a pleasure talking with you. Thank you so much for sharing.
Thank you. Thanks for having us.
Thank you
so much. A great panel.
Yeah, it's very generous of you to share your personal stories as well as your wisdom, compassion, and for all the work that you do to improve the lives of people with breast cancer. I know myself and everyone who's listening is very grateful. And I just want to, thank you, because I know how important that is. And to everyone who joined us, thank you for being part of the Breastcancer.org community. Feel proud that just by showing up today, you're being proactive in your health. Remember, You deserve the best care and support possible. And lastly, I hope you'll join us for our upcoming virtual event on Wednesday, October 13th, when we'll all be discussing diversity in clinical trials and improving clinical trial access for everyone. You can register at breastcancer.org/town hall. Thanks again and take care.